Hey, Kinesis 320, Professor Beans here. So last module, we talked all about the FIT principle and how it is the general guideline that I think the majority of public health entities use to encourage people to exercise. Before that, we talked about two athletes in particular, though it could have been applied to just about any aerobic athlete or endurance athlete. And we'll talk a little bit more about them in this module as well. But at the end of our conversation in the last module, I asked the question, does it make sense for us to be setting general guidelines if we are trying to overcome a specific, or if we're trying to get to a specific outcome? So the question remains, do we use exclusively the FIT principle, or do we find ourselves applying other principles in the way that we prescribe exercise? So in this module, what we're going to talk about is the principles of aerobic exercise training. And you're going to see these again later when we talk about resistance training as well. But let me go back here and show you a slide that I showed at the very end. So a successful endurance athlete has a high VO2 max, high lactate threshold, high economy of effort, and a high percentage of type 1 muscle fibers. We'll talk more about muscle fiber changes in our next set of modules after the next exam. But high economy of effort, what that means is that at a particular given intensity, one is very efficient, highly economical. High lactate threshold, we talked about in VO2, it's moving your lactate threshold over a standard deviation. And finally, high VO2, meaning our absolute VO2 is something that we can attain to, and as a result makes our lactate threshold even that much further away. So we look at this athlete and when we're talking about endurance, and these are the goals that we set out. So if someone says, I want to be an endurance athlete, they might set out with these 4 goals in mind, and in fact, they probably set out with the goal in mind of running a race in a certain amount of time, or running a certain number of races in a year, or whatever it is that they're trying to accomplish. But underneath of those are these physiological changes that take place with training. But how do we get to these? We might apply the FIT principle, which would be appropriate: frequency, intensity, time, and type. But when we think about athletes like this, do you think that whomever is training them just said, okay, here's your frequency, intensity, time, and type? Yeah, basically they did, but there's more to it than that. And my proposition for this particular module is that when you think about public health prescription of exercise, do we have a responsibility, or should we consider what the explicit need is in a community, for instance? So if we're talking about a community of African Americans or Latinos, do we have a responsibility to consider that they have a higher risk for stroke and coronary artery disease, that the prevalence of diabetes is higher? Or do we have if we're treating patients, have a responsibility to offer exercise that is not just generally recommended, but specific to that patient's outcomes? And just like Usain Bolt and Eliud Kipchoge are concerned, had very different training regimens. I guarantee you that Usain Bolt never ran the distances that Kipchoge ran, and certainly Bolt was running sprints far more often than Kipchoge was, because it's specific to what they're trying to do. So there are some principles that we may apply that, if we think about public health and exercise, might be additions that we could add to the FIT principle that would get us better outcomes when it comes to successfully meeting goals. So if the goal is to be an endurance athlete, we know this is true. So how do we fill that in if we think about the principles of training? And the principles of training are as follows: individuality, specificity, reversibility, progressive overload, and variation. I'm going to go through each of these 5 now, and then we can talk about them as we go. So if we're talking about individuality, the key here is that any training program must consider the specific needs and the abilities of the individual for whom it is designed. So in this case, I was talking about last set of modules that everyone can exercise, but not everyone should do every exercise type of exercise. Um, so in this case, individuality builds its way in. There might be genetic differences between us. So in that, what we're saying is that maybe we're more aerobic or anaerobic in certain cases. There are biological and physiological differences. There's disease process differences. So how we process energy is going to be different. How we can take certain impact if we have orthopedic issues. All of this is, so if we set out a general guideline like the FIT principle, it may not take into consideration one's ability. What if someone is wheelchair bound or uses a walker or has loss of sensation in their feet because of diabetes? All of these things need to be considered when we consider individuality. And so one of the things that I do when I train someone is I do an interview with them and I talk to them about their health conditions. I talk to them about what medications they take, whether whether they get orthostatic changes with sit to stand, all of the things that could be important. And I really try to understand what this person is. Not to mention that the way that I assign a type of exercise is not just going to be based off of one's limitations or abilities, but also based off of one's preferences. And so part of individuality is training to preferences or training to goals. If someone has the goal to participate in a 5K, and I'm not even talking about running, a 5K, yes, you should strength train. Everyone should strength train. But a 5K is an aerobic event. And so we want to train with that in mind. So that's individuality. Specificity is where individuality and specificity are this line between how we train someone. So its adaptations to training are highly specific to the nature of the training activity and should be carefully matched to an athlete's, or in this case, anyone's specific goal, specific performance needs. So we think about performance in athletics. We think about what we need to be successful to win the game, to win the match, to overcome an opponent, whatever it happens to be. But we rarely, if ever, talk about which exercises are helpful specifically for a person if they have a goal. So maybe a diabetic patient wants to get their A1C under control. Well, what kind of exercise prescription might we prescribe? Well, I would think that aerobic exercise would be appropriate. I think that strength training would be appropriate. I think every older adult should be doing some mobility of some variety. And what mobility? My dad has a bad shoulder, so I'm going to spend some time thinking about how to get his shoulder mobility back. Some people are going to have a knee pain. But all of these things takes into account what someone is individually and what their goals are specifically. So when we're training, we want to train to the most relevant physiological system for a given goal. So if the 5K, using that as the example, then most of it is going to be aerobic in nature. So we want to train aerobic systems. But if the goal is more anaerobic, then we want to train anaerobic systems. So let's say that one of my veterans comes to me and says he wants to compete in the Senior Olympics. And he wants to run in the 100-meter dash. And after assessing him, we feel like he can do that. I'm not going to send him out for 3, 4, 5-mile runs. I'm going to be working on his anaerobic system to get him ready to run that race. So our training adaptations reflect the type of activity and the training volume and intensities that we choose. So now we have, what does this person want? What are their goals? And how do we build an exercise framework that meets those goals? Okay. In addition to that, we have reversibility. And something about reversibility is that people don't think about how long it takes to get gains. I've told this story a number of times, and I'm not ashamed to admit it. I weighed 322 pounds in 2007. As I sit before you, I weigh 264, which is up a little bit because I put on a little weight during COVID, to be perfectly honest with you. And what you discover is reversibility of weight loss is something that happens very quickly. It takes a long time to get on and very easily to get back on. I'll tell you a story about a participant that we have here. I can't tell you much because of HIPAA, but what I will tell you is that prior to COVID, he was regularly exercising with us. He has a number of metabolic disorders, and the chief one of them is PAD, which peripheral artery disease, which he acquired after a car accident. This gentleman exercised with us, and then it was about a year from the time that he was able to get back into the gym after COVID and all of the shutdowns and all of this. In that period of time, he put on 20 kilos of weight, or about 40 pounds, 40 plus pounds, to be honest with you, closer to 50. Now, I will tell you that within a week or two of starting, he lost a fair amount of that weight from Jump Street, because a lot of it was water weight. He wasn't moving as much, therefore he wasn't getting water out. Plus he has PAD, which means he's not moving the circulation that well anyway. But it took no time at all for him to get the gain. It took a long time for him to get the gains, but it also took him a long time to lose those gains. And so training programs must include a maintenance plan to ensure that adaptations from training are not lost. So another story I've told, my niece Kaya is 14 years old, and she is a above average soccer player, and she plays club soccer. And one of the complaints that I've given to my brother and sister-in-law is that she rarely has an off season. And as a result, she's prone to injury. But one of the things that I've noticed about American club teams is they don't necessarily spend a lot of time talking about maintenance. So when they do have those few weeks when they're not working out, it is often left to the athlete to figure those things out. So the gains that you get are lost very quickly. So detraining yields the reciprocal. If we get all these benefits, then detraining or not training at all leads to the loss of these gains that we had, which is problematic for the athlete. And it's even more problematic for the chronically ill or just the normal human being. So Dr. Pryor, who again, I've mentioned a few times, he's done a lot of great work, did some work in skeletal muscle capitalization. I may have actually shown you one of these papers before. It's really good work, but he did a detraining that looked at insulin sensitivity in older adults. And if you look, I'm going to pull out my pointer here. So in this, this is a really, really cool image. So what we're looking at here on your y-axis is basically a measure of insulin sensitivity. It's not important that you understand what it is, but it is a measure. And the higher the number, your gains are better. When the higher number, the better is what I'm trying to say. So you can see in this group of older adults, this is baseline, and then this is 6 months of exercise, and this is detraining. So what you can see is they get lots of gains when they've done their 6 months of training. So what they did is they did these tests, and then did an OGTT, and they got the results, and they may have done a glucose clamp. I can't remember. But what you see is the significant difference between baseline and 6 months of training. But as you can also see, they did this detraining portion in which they did hyperinsulinic and euglycemic glucose clamps. So you can see that in a very short period of time, they've lost some of the benefit. Now, have they returned to baseline? No, but give it time and they will eventually get back to baseline or even worse. So the whole idea of this is that we have to do something to maintain the gains that we make. It only took about 2 weeks, by the way, for them to lose these adaptations. In 6 months of training, 2 weeks, they already are starting to lose some of the benefit from their training. So we know that we need to maintain even if we're not in full training mode. And then there's progressive overload. So we talked a lot about intensity in our last set of modules. And one of the things I said is that as we get fitter, the floor that we have rises, because what previously was 60 to 85% of heart rate reserve is now needs to be even higher. So the training stimulus must be progressively increased as the body adapts to the current stimulus. If we don't, then we cannot maintain and may even lose some of the gains that we could potentially have. So we must increase the demand on the body to make further improvements. So you can't just, as I said with my wife, Lynn, you can't just go into the gym and do the same thing all the time and expect to see the same results. You have to continue to push the body to make improvements over time. And finally, we have this principle of variation, also known as periodization. Periodization is something where we have macrocycles, mesocycles, microcycles, and the whole idea of this is you have in-season and off-season. The way we train prior to an event means that we try to really push hard to get ready for the event, but during training season, we take it easy. And periodization is sometimes hard for people to understand in just normal people. It makes a lot of sense with athletes because they have, baseball is just starting up. Opening day was yesterday. It's a great thing because they can, they finish up in October or November, sometimes earlier. If you're an Orioles fan like me, it's always earlier. But in the off season, they train differently than they do in season, because if a pitcher were to lift weights the way that they lift weights in the off season, they might become too fatigued. And so, but how do we apply this to someone and their goals? Well, one thing is if weight loss, for instance. I find that in my process, it was good for me to go through a process where I would go through a series of months, weeks, whatever, of cutting, and then level off and try to maintain that weight for a period of time, and then cut and maintain that weight and cut and maintain that way. But we have in the case of athletes, we'd have a base building phase, a sports specific phase, and a recovery phase. It may be that we have a weight loss phase, then a weight maintenance phase, but essentially it's all about intensity and volume and keeping these things in order. So if we're talking about athletes, for instance, maybe you're an EPL fan, okay? If you're in the EPL and you're playing soccer, you know that during the season, they play a tremendous number of games. They are playing all of the time. So their volume of training changes pretty significantly because they're playing at the highest level all the time. But when their intensity decreases, then their volume can go up. So there's this adjustment. And again, intensity is the fulcrum for all of these things to happen. And so as the intensity of competition or the intensity of weight loss wanes, then we can, or when we want to try to maintain and the stress is there, then we sort of back off and we let it do our thing. So principle of variation is really an important aspect. So those are the 5 principles of training. As you can imagine, this is kind of hard to think about because the FIT principle is very easy to apply in many respects. I give a generic value of how long I should be exercising, how many days a week, but it really doesn't speak to intensity. And I think one of the things that progressions of exercise training does is it really thinks carefully about intensity, and it considers what one is trying to achieve. And if we were to apply those in a public health forum, what would that look like? So you guys have an assignment, and I've posted it already, but I want you to find an organization that's doing exercise as a public health outcome. It could be a hospital that's doing exercise programming. It could be a YMCA. It could be any number of things. And what I want you to do is I want you to evaluate how they're doing in progression of their exercise. Are they using FIT principles? Are they following certain guidelines? And sort of give me a feedback on what you think they're doing and how they're doing. And in that summary, what I want you to do is I want you to say how you might maintain or change things to better meet the needs of whatever the population it is they're trying to reach. If you have questions about the assignment, do let me know. If you don't have questions about the content, let me know. And if you don't have any at all, I'll see you guys on the web.